Chair recognizes Mr. Driscoll of Braintree.
Thank you, Mr. Speaker, and through you to the members. I rise to speak in favor of House Bill 1696, an act relative to assault and battery on healthcare providers. Legislation that would stiffen penalties for violence committed against healthcare providers across the Commonwealth. Workplace violence in hospitals is a major public health concern. A hospital should be a place of healing where the sick go to get well, where doctors, nurses, and other healthcare professionals come together to treat patients and work to make our Commonwealth a better place. Unfortunately, increasing acts of violence against nurses and other healthcare professionals undermine these efforts and derail our hospitals from their critical mission. The number of violent acts committed against healthcare providers is surprising. Results of an Emergency Nurses Association survey last year found that more than 50% of ER nurses had experienced violence by patients on the job, and more than 25% had experienced 20 or more violent incidents in the past 3 years. Indeed, these are alarming statistics, and we should not tolerate this type of violence in our hospitals, in our emergency care settings. Nurses and other healthcare workers suffer violence at a rate 12 times higher than other industries. Thank you, Mr. Speaker, and I thank the gentle lady from Boston for her attention. As I was saying, and I thank you, my fellow members, for your attention. As I was saying, nurses and other healthcare workers suffer violence at a rate 12 times higher than in other industries. Indeed, in the Commonwealth, a survey conducted in 2004 revealed half of Massachusetts nurses had been at least punched within the last 2 years. At a Southeastern Mass hospital, there was an average of 3 911 phone calls per day made from within the hospital. This violence can range from verbal and emotional abuse to physical assault and very serious crimes. It can be perpetuated by family members, by patients, friends, or visitors to the hospital facility. Violence takes an immense toll on victims that go beyond physical injuries. This is true more so when that violence is perpetrated at a person's workplace. It corrodes an employee's sense of safety and morale in the workplace, negatively impacting their productivity and the mission they're there to accomplish. Increased protections for individuals in the healthcare industry are essential for creating a safe and therapeutic environment for our patients. It will be a strong, clear message for us to pass this legislation today that we value the work of our nurses and that of all employees in our healthcare settings. Under this legislation, an assault and battery on nurses, registered nurse psychologists, physical therapists, occupational therapists while on duty will result in penalties of up to 2.5 years in prison or fines of $5,000. Our nurses deserve the same protections currently afforded to EMTs, ambulance workers, and attendants. I respectfully ask members to consider this legislation positively, to join with me in supporting it, and I ask that when a vote be taken, it be taken by a call of the yeas and nays. Thank you, Mr. Speaker.